All right, so the question you want to figure out first is there core issues that are causing the neck to be tight, or is the neck involved in other compensation patterns that are made? So is the neck a result, or is the neck more a causative factor? Right? Because people can use their neck muscles to compensate for core issues. And tomorrow I'll explain that more. But getting back to Tom Meyer's anatomy trains, remember that these anatomy trains don't end here just because my class is focused on ending here today, but they continue all the way up to the cranium, right? So for you to think about, if you're working on somebody and you're getting some results, but they still have they're still testing positive, right? And think, well, maybe they're using something in their upper back or their neck. It happens a lot. So, what's going on with your neck? Is it tight?
Yeah,
Does it hurt?
stiffness, yeah. Stiffness and sore, traps are tight, and
Okay.
shoulders are stiff. They've
All right.
been torn.
Torn both rotators? Okay.
Lots of whiplash.
Oh, this is interesting. Okay. What happens in whiplash? It's a traumatic event. It imprints heavily. So as far as motor control is concerned, it just happened. It doesn't matter chronologically. It could be years ago. It could be months ago. But it's heavily imprinted. It's a fairly traumatic event. And so we have to look at the entire spine as a functioning unit. Okay, so what I'm going to do is start you face down. I want to look at the spine. Okay, so I'm going to do some palpation of the spinal muscles and find some tension there, the left mid-back area, but oh, I felt a lot more tension in the neck. Okay, so lying down, really it's right here. All right, so, well, since I already got you lying down, I could do a number of things. I could check the hip flexors. Hold this leg down on the table. Good. I could check trunk flexion. Press down. I could check rotation. Press both feet against my pressure here. Good. Okay. And there'll be more that we can look at tomorrow. I don't want to get too ahead of things. All right. Let's have you sit on the edge of the table. Kind of want to keep it focused on mostly on what we're doing today. All right. Good. Move back so your knees touch the edge. Good. All right. Arms up. And match my pressure. And it's a little off. Okay. Match. All right. Relax. And match. And relax. Okay. Gotta rest my fingers a little bit. Going back to this mid-back tension. Do a quick release, a little cross fiber with my tool. It's very expensive, but it's nice. It's all granite, polished. Match my pressure. There we go. Again. Good. And again. All right. So the erector spinae here in the lower thoracic will compensate for the abdominal wall. Okay. Well, let's see. I was palpating and your left side was tighter, so I'm going to go back and do one-arm tests on the left side. Match my pressure. Good. Rotate. Match. Good. And match. All right. Good. So that was pretty good. But you see, I start moving the shoulder girdle around. Yeah. So, oh, and by the way, the upper trap, people say my traps are tight. Yeah. upper trap is a fairly thin sheet of muscle, and it's not usually substantial enough to do much compensation. So it's usually the muscle underneath, which is the levator scapula. Yeah. Okay. So I was just kind of cross-fibering it to relax a little bit. Match my pressure. Yeah. Okay. Match. And match. All right. So getting back to Mr. Myers, I'm just going up the line a little bit from what we studied so far, right? And also, when I look at what he calls anatomy training, which we'll get into tomorrow, I have a little broader viewpoint. Press here, based on what motor control teaches. Press. And press. Good. Their motor control is not quite as consumed with proper anatomy as we are. Right? It's more pragmatic. Okay, so that was good. So your levator scapula here was compensating for your obliques on the same side. Who would have thought, right? All right, let's have you face down. Excuse me, face up, face up. There we go. See, good range of motion, but it's bugging you, right? So right along the spine, there's tension. Hold both legs down on the table. Good, relax. Pull down. All right. And pull down. All right. Relax.
So what do you see? Because it's almost
Yeah,
like she's gripping.
Because I was watching
Yeah.
Darlene earlier, and I saw her neck getting all rigid when you were testing her extension. Right? I'll explain what this relationship is tomorrow. Press down. Good. Press down, and look at that.
Better.
Press down.
Oh my goodness.
Test, release, test, release the compensating muscle, retest. That's always true,
Yeah.
right? So this is why you have neck stuff, because this is another thing, whiplash is not a neck injury. I mean, yes it is, but it's not just a neck injury. I look at the entire spine all the way into the coccyx, right? It's a functioning unit. So when they said whiplash, I look at the entire spine to see what kind of issues are going on. Here you had your neck extensors compensating for your lumbar extensors, right? So who's to say that the whiplash didn't overload your lumbar extensors and cause them to go offline and need compensation? And of course, we still want to do all the other whiplash treatments and stuff, but let's just give you an idea of what happens and how the compensation can go beyond what we're learning, but if you learn the principles today, you'll still be able to figure it out. Okay, that was good. So we had neck tension compensating for core. We had levator scapula tension compensating for core. Right? And then we had erector spinae compensating for core. Okay?